This presentation is on central line-associated bloodstream infection prevention. Introduction. What is the problem? Central line-associated bloodstream infections, or Clabsies, are a problem amongst many hospitals and organizations. According to Anaskowitz and Conwell, central venous catheters, or CVCs, cause approximately 250,000 central line-associated bloodstream infections annually in hospitals in the U.S. This contributes to increased patient morbidity, mortality, and hospital costs. All negative things. The rationale behind this: several patients have central lines, and it is our job to do our best to prevent negative outcomes related to infections. Working on an inpatient oncology unit, there's always opportunity for improvement in central line management. The purpose of this presentation is to discuss research surrounding Clabsi prevention through literature searches and syntheses. Research question, formulated in the PICO format: P for patient and population, I for intervention, C for comparison, and O for outcome. So the question is, in adult hospitalized patients with a central line, does the implementation of a central line care bundle compared to no implementation of a central line care bundle reduce the rate of central line associated bloodstream infections? So first up is a literature search. Online libraries are always great tools for research. When searching for a specific topic, it's important to select narrowing components, otherwise too many results will come up. A database like EBSCOhost will help to deliver quite a few results, and then we are able to narrow the results by selecting some of the following options, such as peer-reviewed, research article, PDF full text, since a copy of the PDFs need to be available for this project. And then the research articles should also be relatively recent, since practice is always changing. And a lot of these needed to be within the past 5 years. So you can type in specific dates, for example, April 2015 to April 2020. Then type in the topic into the search bar. You can just type in the word that you're primarily researching. You can type in more words. You can spell out the acronym. So for Clabsi, you could type in Clabsi. You could type in central line associated bloodstream infections. I typed in Clabsies and it resulted a fair amount of options. It's about 16 articles after I had used the narrowing components. So it wasn't too hard to kind of read through, skim through the articles, figure out which ones were most applicable for this project and that I wanted to use. If there are too many results or too little results, go back to the search board. You can broaden the topic, you can narrow it down. There's always different ways to do both of those. For the Clabsi topic, for example, you could search Clabsi, you could search central line associated bloodstream infection, you can search Clabsi prevention, Clabsi bundle, Clabsi rate. If you're looking for specific interventions related to Clabsies, you could do Clabsi on the top line. The second line could be, for example, chlorhexidine gluconate bathing. If one was searching if CHG baths helped to reduce the Clabsi rate, for example. So plenty of different ways. This is what worked well for this project. Next up is a literature synthesis, so comparing and contrasting the articles that were used. So similarities of the author's discussions were implementation of a central line or central venous catheter maintenance bundle. Almost every single author agreed that there needed to be increased educational needs for staff. Each author performed research in a hospital setting. None of the authors discussed home care or home health related to central lines. And then the authors that did implement an intervention did share an outcome of a reduced Clabsi rate. This next slide here kind of compares and contrasts some of the interventions. So all of the authors listed here, Cooney et al., Gregonis et al., and Settle, Buffington, Madden, and Dawson, all implemented some sort of intervention. Cooney et al. Implemented a CHG alcohol swab, which resulted in a 65 reduction rate in Clabsi's. Gregonis et al., they implemented a CVC maintenance bundle that hadn't previously been in place in a long-term acute care hospital, which resulted in a 29% reduction rate in Clabsi's. And then Settle et al., they implemented increased patient education and empowering patients to hold their caregivers accountable, which reduced Clabsi's by 43%. So some differences and similarities amongst these authors. As you can see, there's 3 different interventions that each set of authors implemented. Each set of authors also share a similarity in that the Clabsi rate was reduced based on the intervention implemented. Some further differences amongst the authors. Some authors chose different settings. So Gregonis et al., they primarily looked at long-term acute care hospitals. Cooney et al., they looked at dialysis patients in a North Carolina health system. Hacko et al., they looked at a 13-bed med-surg ICU in Turkey. And Settle et al., they looked at a 29-bed hematology-oncology unit in Alabama. So all different settings. Some were specific to certain types of unit, others were hospital in general. And similarly, authors sampled different sample sizes. So Cooney et al., and Settle et al., they looked, as I mentioned, at specific units or populations. So Cooney with the dialysis patients, Hacko with the ICU patients, Settle with the hematology-oncology. However, Gregonis et al. And Sheff et al., they looked at specific organizations. So Gregonis did the long-term acute care hospitals with Select Medical, which was 30 different hospitals. Sheff et al., they primarily looked at one hospital but 5 different units within that hospital, in which those units were serving med-surg patients. And then, of course, there are differences with the interventions placed. So Cooney et al. Looked at the implementation of a CHG alcohol swab in cleaning the hub of a central line. Gregonis et al. Looked at the first-time implementation of a maintenance bundle in the long-term facilities. Settle et al. Looked at increased patient and staff education related to central line management and care. Hacko et al. Looked at the measurement of compliance related to a central line care bundle. And then Sheff et al. Didn't actually place an intervention. They simply just monitored line manipulations because in most Clabsi bundles, line manipulations are not included. And they believed that they should be. So, reflection on the literature synthesis. When synthesizing literature, it's important to try to remember to draw comparisons and similarities. Almost any article can be compared to each other. Certainly there's going to be similarities, and obviously there's going to be many differences. All of these authors that I had mentioned discussed Clabsi's and prevention of them through a maintenance bundle, but almost each one of them discussed a different subcategory of prevention with a specific intervention. Or, as I mentioned, in Sheff et al.'s, they didn't implement an intervention, but they were suggesting a change to the Clabsi bundle. Some challenges in a literature synthesis could certainly be comparing apples to oranges in a sense. Sometimes when you're looking at different interventions, it can be tough to draw conclusions that way. However, if you are able to take some of the information and broaden it, most of it can be applicable to what you are researching. So, practice management or recommendations. Obviously, certain precautions can be taken to prevent Clabsies. We should always identify risks and warning signs of patients who are at a higher risk for getting a Clabsy. Implementation of central line maintenance bundles is key. Most organizations already have them in use, but there's always areas of improvement. There's areas of non-compliance, specifications of things that are not addressed, such as the line manipulations, or teaching patients what they should expect their nurses to be doing when caring for them with their central lines, which ties right into the next point. Ensure education is completed with both staff and patients, and then work closely with other high-risk populations to learn from one another. So, for example, oncology and dialysis both deal with several patients that have central lines. There's no reason that they cannot collaborate when they have a central line associated bloodstream infection to kind of learn from one another, since most of those findings could be applied to each practice. So an actual change to implement in my practice would be patient education included in the central line maintenance bundles regarding what to expect from healthcare professionals that are handling and caring for the patients with a central line. Both Settle et al. And Grigonis et al. Did mention about patient empowerment and being sure that they know what to expect when a nurse is handling their line, how long the nurse should be scrubbing the hub and letting it dry before connecting anything, whether their line should remain clamped or unclamped, things like that, how often the dressing should be changed. All of that is important for a patient to know because it's a sense of accountability that they can hold their nurses to as well. To implement this, staff education would first need to occur on what to educate patients about. It would have to be expanded to teach patients that, like I said, they must scrub the hub for the nurses must scrub the hub for 5 seconds, let it dry, that it should remain unclamped, so on and so forth. This could be documented easily under EPIC in the Education tab. Potential issues, it really wouldn't be costly, but it would require education, and then compliance would need to be monitored. Conclusion and takeaways. Clabsi research can be applicable to several different specialty areas. Don't limit research to just one area because a particular specialty area is not the one you're searching for. So, like I mentioned, collaborating with other units. And then Clabsi prevention, specifically, research supports that the implementation of a central line maintenance bundle in the adult hospitalized population helps to decrease the Clabsi rate compared to no maintenance bundle. Best practice is always changing, so it's important to continue to research to stay up to date. And then this is a list of all of the references I've used, and attached will be the Word document with them as well, and the articles. Thanks so much.